Hi, I'm Emma Smith.
And I'm Gia Patel. And we're ambassadors for the CDC, the Centers for Disease Control and Prevention.
Today, we will be talking about autoimmune diseases, specifically primary biliary cholangitis. An autoimmune disease is when your immune system attacks healthy cells. PBC specifically targets the liver and bile ducts by making the liver bile get caught up and then destroying healthy liver tissue.
We will now be going to Morgan Davis to learn about the 4 stages and symptoms of PBC.
Go.
Hi, I'm Morgan Davis, Head of Research at CDC. Today I'm going to show you the 4 stages of PBC, also known as primary biliary cholangitis. The early symptoms of PBC are itchiness and fatigue. You also might experience dry eyes and mouth. Later symptoms are pain in upper right abdomen, swollen body parts, muscle joint and bone pain, weight loss, high cholesterol, fatty deposits on the epidermis, also known as the skin, jaundice, which is the yellowing of the skin and eyes, hyperpigmentation, which is the darkening of skin not due to sun exposure, diarrhea, and osteoporosis, which is the weakening of bone. Now we're going to move over to the 4 stages of PBC. The first stage is the portal stage. Here you're going to have inflamed bile ducts and little to none symptoms. So the little to none symptoms, you would not experience any of these symptoms. When you come to the periportal stage, you're going to experience periportal fibrosis or inflammation. Fibrosis is the excess formation of tissue and can result in scarring and permanent scarring. Tissue as in any organs. Something you may also experience in the second stage is symptoms becoming more present. So those symptoms will be itchiness, fatigue, and dry eyes and mouth. The third stage is the septal stage. Here you're going to experience active or passive fibrosis. This means it may not be occurring yet, but it may start soon. Symptoms are now occurring in this third stage. Now we're moving on to the 4th and last stage. This is biliary cirrhosis. Cirrhosis is the liver damage that leads to severe scarring and liver failure. You're also going to experience permanent damage to bile ducts and liver tissue, severe symptoms, which include these later symptoms: pain in upper right abdomen, swollen body parts, muscle joint and bone pain, weight loss, high cholesterol, fatty deposits on epidermis, jaundice, hyperpigmentation, diarrhea, and osteoporosis. Now we're going to move on to the treatments and diagnosis.
Hi, I'm Sydney. I'm the head of treatment at CDC, and I'll be telling you more about the diagnosis and treatment for primary biliary cholangitis. The tests involving diagnosing PBC are cholesterol tests and liver tests and antibody tests for autoimmune disease. Imaging testing may not be always necessary, but sometimes the doctor will need confirmation that you have PBC. This confirmation test will include ultrasound, MRCP, ERCP, and MRE. Treatments for PBC include UDCA, Aclivia, and an association of other medications. A liver transplant may also be necessary, but that's only when the medications are not working for the patient like they should be. But with a liver transplant, the liver may contract the disease again. There is no cure for PBC, but there are medications that can slow it down. Now back to our ambassadors, Emma and Gia.
Primary biliary cholangitis is a hereditary autoimmune disease and is found in women aged 30 to 60. It is prominently found in Northern America and Northern Europe.
PBC can lead to other diseases such as rheumatoid arthritis and CREST syndrome, but it can also lead to other serious issues such as thyroid problems, memory loss, and gallstones.
Brought to you by the CDC.
Bloopers!
Holla at your boy!
Masters of the CDC. Okay, hang on. Can you be quiet?
I was.
We're on
Primary binary colonocytis. I can't
go 3, 2,
I
1. No, okay, so
Okay.
did you hear that?
Of primary biliary coronary bilingitis.
Centers for this. I thought we weren't saying that.
Just keep it in. I don't care at this point.
Go ahead.
Welcome to the CDC
Cut. Read.
I use the thing.
Yeah.
1, 2, 3.
Welcome to the CDC, Centers for Disease Control and Prevention.
Period. We did that. We're done. Bye.